Hey, it's Mickey with Motion Restoration. So in today's video, I'm going to be showing you how to massage someone who's just had a cast removed. Now this video can be used for any part of the body that has had a broken bone. The cast has been removed and has had a physician already cleared them to get a massage to go to physiotherapy. So my patient today has had her cast removed from a right-sided collis fracture from 3 weeks ago. I want you to position the person in something that they are the most comfortable in. All right, let's get started. All right, so we have our lotion. You can use coconut oil or something that you know will help with the patient's skin. Now, when you do remove the cast off of the skin, you're going to notice that because of the stretching from the swelling, the skin tends to be quite dry and cracked. So use something that is a nice moisturizing. Now, as I had previously stated, we have a right-sided collis fracture here, and we notice there is quite a bit of swelling within the hand. So what we're going to do, we grab our lotion. We always start at the most superior, which is the furthest away from the joint and closest to the center line of the body. This will help to open up the joints to help with releasing a lot of the swelling that is in the wrist here. So we're going to move the lotion in our hands, warm it up nicely. We're going to apply a very light pressure to the area, pushing towards the center line of the body. All right, so big thing with post-fracture is noticing there can be areas of sensitivity. So always checking in with the client to make sure that this is going to be something comfortable for them as well. Notice if you're using too much pressure. So first few passes, all you're going to be doing is using just the palm of your hand and you're lightly going on the surface and you're just pushing towards going up the arm, so towards the armpit, towards the elbow. So nice light movements. Now massage really helps once you've had that cast removed. It's going to help with that muscular tension. There's going to be a lot of tension buildup where that fracture is with the muscles. The muscles kind of go on high guard and they really get tight around the joint where it has been broken. So the goal with this is to try to increase blood flow, try to decrease swelling, but we're also going to try to decrease the muscular tension around the joint that was broken. All right, so then we're going to go a little bit more specific. So for this, we're actually going to start a little bit more superior. So just in front of the elbow here, we're going to start where all of the muscles in the forearm are actually originating from. So this is called the common extensor tendon. So we're just going to use our thumbs and we're just going to pass over this joint nice and lightly just to relax the muscles in the forearm. There we go. And then we're going to work our way down the forearm. So again, just using medium to light pressure. Go nice and slow just so we can really feel where the tension is building up in the muscles. And then we're going to work our way from the outside bone. And then we're just going to use these thumbs and we're going to work our way into the inside here. There we go. And then we're going to work our whole way down, doing the exact same thing. So starting on the outside, into the middle, and then to the inside. Just work our way all the way down that forearm into that swelling. So once we hit the area of swelling, you might notice there's some heat coming from it. So that is still an indication that there's some swelling in the area. And you're going to go light. So you're just going to go, it's a very soft feather-like pressure. So we're just decreasing the swelling in the area just by pushing up towards that center line of that body. Just like this, going over the swelling, nothing too hard. All the way down. And then flush the blood up the arm again. So we're flushing up. And then within the patient's tolerance, we're going to rotate over and we're going to work on the other side as well. So this is the flexor side of the forearm. So again, we talked about how the other side of the forearm has the origin of where the muscles start. The same is going to be on this side. But on this side, the origin of these muscles starts closer to the inside of the elbow. Now this can be quite tender. So this is the common flexor tendon area. So I'm just going to support her wrist with one hand and I'm just going to massage with the other very lightly. There we go. So we're opening up these tight muscles. So this is where you're going to notice there's quite a bit of tight muscles that are going to be above where the joint was broken. There we go. So same thing. We're going to work our way down, going from the inside, pushing upwards, flushing that blood. There we go. All right, now typically when you do have that cast off as well, you're going to notice swelling isn't going to be, it's very local, but it's not going to be just on one side. You're typically going to notice it's going to encompass the entire joint. So make sure that you're going to be doing that nice light movement over top of the joint with the swelling. Try to decrease that swelling there. And flush it all up. So we have that retinaculum here, which lies along the wrist, and I really want you to get into there because this retinaculum can actually get quite tight and it can block a lot of the swelling on both the flexor retinaculum, and then we're going to go around and then we're going to do the extensor retinaculum all the way around that wrist. Perfect. And then we want to get a little bit more mobility into this joint. So what we're going to do is we're going to do a little bit of a traction. So I want you to support below the joint and above the joint, and you're just going to pull them apart ever so slightly. A little twisting, a little bit of movement, and then again, a little bit of twisting, a little bit of movement. There we go. And then I'm going to get into the thumb. So we're going to twist and move the joints of the thumb, and we're going to go throughout the fingers here. So again, we're just trying to bring in that blood supply. It'll also help with this lotion that you have. It'll help with the dryness and the cracking of the skin. So work our way throughout all the joints. Pushing the blood. So I'm just using the heel of my thumbs and I'm just pressing along the top of the hand here. And then I'm going to do the same thing. Again, we're going to rotate that hand open and I want you to spread the pinky, the thumb. So we're just opening the palm up. So a lot of tension will get built up in the hands, especially from not being used for so long. Everything kind of becomes stiff and rigid. So we're just trying to increase that blood flow to the areas, decrease the tension, try to decrease a lot of the swelling that's in here. So it makes it a lot easier for you to move that joint. The last thing that we do in every massage is we flush the blood towards the center line, towards the heart. There we go. So that is a quick massage that you can do for someone who has just had their cast removed. Now I just showed you an example on the wrist. This can be used for any broken bone. Now you want to go within the patient's tolerance of pain. If they're saying that's too much, then it's too much. If they're saying the next day that they noticed, oh my gosh, it was hurting so bad, you went too much too soon. So I like to recommend within the first 72 hours of removing the cast, you can perform a light effleurage, a light massage on the arm, and then you can eventually build up to going a little bit deeper. First few passes, you're only going to do between 5 to 10 minutes. And then you can work yourself up to help someone out for about 20-25 minutes. You want to make sure that you're opening up the joints above and below the area that was injured. And that light movement of my thumbs that I was showing you, that'll help with swelling. So I hope this helped you out, and I really hope it helped out the person that you are there for as well with their broken bones. And I wish you the best of luck, and let me know how you found this treatment. We'll see you next time. Make sure to like and subscribe, and if you have any questions or comments, please leave them down below.